Hi, my name is Nurs437. This is my midterm diary for Nurs437. So far through this course, I've learned a lot, really opened my eyes to how many different areas nurses work in that I haven't really ever had an experience with, and just how present we are in people's lives throughout like all the different stages of people's lives. I mean, so far we've learned about everything from a well baby visit as a newborn to palliation at the end of life. So we're kind of there through the whole spectrum of life. So we've touched on a lot of different topics, but I'm going to talk about my top three so far. My first one would be the pediatric palliative care presentation that we had during our first session there as a group. It was really something that I never had any experience with, and I thought that I knew palliative care quite well because I had worked in adult palliative care for years. So I thought that I had a pretty good grasp on palliative care, but seeing how different that is for pediatrics, for example, in adult palliative care, we're usually talking months at end of life with an illness that's come on suddenly in a previously healthy adult, whereas in pediatrics, some children might be palliative comfort care from basically their time they're born, and for say 3 or 4 years if they are born with a genetic life-limiting illness. So it's definitely a lot different and just a very different area than what I'm used to. So that was really an interesting topic for me. My second one, which might actually be my most eye-opening one of everything, was our unit on adverse childhood experiences, or ACEs. I had a pretty good understanding of the fact that trauma in people's lives could, make them more susceptible to things like mental illness or substance use. But I just really was shocked at the statistics of just how more at risk people were for things, even like heart disease or cancer, from having adverse events in their childhood. And it made me really think back on some of the patients that I've had who maybe had a difficult upbringing and were facing illness later in life, that maybe in the past they would have thought that it was from something that, like lifestyle choices that they'd made. But now I kind of have a better understanding going forward that sometimes things that happen before someone even has the choice to make their own choices can affect their health for the rest of their life. And then my third one was learning about vaccine hesitancy in one of the last chapters that we've done here in the last couple of weeks, and just how that can happen in large populations, such as with the MMR vaccine and autism connection that, we of course know is not real, but a lot of people still believe that. And I think that's really prevalent now with the COVID-19 vaccine. So I think learning how that can happen and how we can have those conversations with people who are experiencing vaccine hesitancy is really something super important right now, because I think like all of us in healthcare are facing people who are really challenging vaccination at the moment. So I think that one was very important. So overall, I'm really enjoying this course so far. It's really been an eye-opening course to a different side of nursing that I'm not really that used to, and I'm really excited for the rest of the course.